the Vasc-Omics disruptive technology. That's my disclosure, will not affect any part of my talk today.
Looking to upskill for the future?
This new AI can perform all coding jobs in seconds, including blockchain development. While this AI is already outperforming accounting firms. Meanwhile, the new graphic design AI aims to automate graphic design and could minimize.
Relax. Because in a future where AI does most of the work, there'll be one thing that humans will finally get to do all day long. Nothing.
Current obsolete diagnostic algorithm. We think that we're doing great. We do clinical examination as we've been doing for the past 500 years. We do a CT scan, MRI, genetic swaps and testing and diagnosis, and we sit in a multidisciplinary team and try to decide what we're going to do. But we don't have enough knowledge because we don't have the ability to get all the big data analyzed. And then we give a diagnosis which 50% may be right, may be wrong, and we could give the wrong decision for a bad management. Vasc-Omics integrated technique mandate new ontological biological approaches for cardiovascular diseases. The lure of obtaining large dataset will replace any clinical trials, and investigator must understand technical and biological strengths of Vasc-Omics approaches. And virtual clinical trial simulator is the way forward.
Proposes would appear at the high end of the periodic table.
Yeah, listen, you have a ball with that. I know it's going to work.
The idea of trying to do a clinical trial and not using virtual photonic-aided clinical trial software is a nightmare. We cannot use human being as guinea pigs. This is gone. It's a criminal act. Modern imaging technology should be considered a top priority in every center providing endovascular management of aortic pathology in order to attract trainee and educated patients, as radiation levels are currently dangerous. Individuals who underwent a procedure with augmented intelligence had superior outcomes than those who had procedure without augmented intelligence. And this is in the four major parts of any endovascular intervention: the operative time, the contrast, the radiation exposure, and the fluoroscopy time. So we start using general AI just to get exactly what's going on. And from there, we will see where we can go. Transformative advancement in vascular clinical practice. Vasc-Omics identify resilient vascular trainee, accelerate discovery of trainee vascular phenotype that withstand high radiation exposure. ASAC volume mapping, enhanced predictive modeling, and personalized treatment strategy as it guides intervention based on SAC expansion as a surrogate endpoint. Dynamic fusion imaging as it reduces intraoperative radiation, intervention duration, and contrast use. This is through using super AI and quantum computing in translational medicine. We know that radiomics is optimizing cardiovascular imaging measurement and how the result of this measurement can be read and utilized. Vasc-Omics in vascular care predict disease risk using tools like XGBoost and SHAP, guides patient care on precision risks and profile. We know currently that the Vasc-Omics identified atherogenic pathway and created therapeutic targets to address AAA and PAD with CRISPR and gene editing. Moreover, we try to integrate Vasc-Omics into the vascular training algorithm and leverage advanced genetic screening to identify RNA-resilient candidates against radiation, ensuring safer selection of vascular trainees. This innovative approach prioritizes radiation resistance, future vascular surgeon, minimizing long-term health risks and mitigating medical legal liabilities while redefining safety standards in vascular medicine. Remember that professional fee does not equate for the lifelong risk of radiation exposure for physician, hospital, and patients. If you get lymphoma or leukemia or a brain tumor, nothing will pay for that. You will regret for the rest of your life that you didn't take care of yourself. Now, this is one of our publications. It has been published 2 days ago. There is significant diversity and abundance of gut microbiome taxa are observed in Takayasu arthritis, giant cell arthritis, aortic aneurysm, and aortic dissection. with greater dysbiosis compared to healthy control groups. Beyond traditional intervention like fecal transplantation, probiotic and dietary changes, Vasc-Omics will enable precise modulation of gut microbiome. Primary outcome aim to prevent or halt the progression of aortic diseases. CIDR revolutionizes the AAA management, dynamic volume-based insight as it tracks SAC volume changes and behavior over time, delivering critical objective insights into progression and treatment efficacy. Data-driven decision-making reduces reliance on subjective MDT consensus by employing predictive analytics for conflict-free, evidence-based outcome. It will be better than any professors or consultants or people who think they know better, because the ability of them to analyze is far superior than any other one sitting in the room. Now, avoiding stroke in complex arch procedure has been recommended. Use of image fusion to assist endovascular procedure is mandatory, as intelligent smart fusion imaging will assist in doing this. This is one of our arch cases, and you can see how complex it is. But when we have using the fusion imaging, the movement, the machine learning, the artificial intelligence correct itself and make things work easier for us in order to produce the final outcome, as you could see from the last slide over there, that things are looking better and better and better as we are operating on it. The whole idea in here is very important to have it, and you have to teach the software in order to work perfectly. And the only way to do that is to have the ability. So this is the end game, and you can see how nice it looks exactly as been built on the fusion imaging. Now, the new kids in town, the My IQ image guided system, it will able to depixel and make things so clear for you without taking any more radiation or increasing the density or even enlarging your DSA. The auto-write 6P control device, it will allow you to know exactly what you're doing. It put the filters, the detector dose, and makes things much more easier for your work. The Ops EM AI navigation system is a force exactly, and it works with magnetic in order to allow the wires to cannulate and do everything for you without having any radiation. And the last one is the Omnify XR augmented reality. It's done by GE, and it will change the way that we approach all of our cases. Mr. Chairman, ladies and gentlemen, transforming antiquated medical education through AI and big data analytics both will set to pioneer a new era in precision medicine, redefining vascular disease management. Future-proofing of vascular surgery by building a resilient workforce equipped with advanced scientific insight and predictive tools to address modern challenges with confidence. This is the future that we must be part of it. It's the only way forward. And I hope I had made my message clear for everybody. Thank you so much for the opportunity to present today.